Hi, my name is Patrick Howard. I serve as the CEO and Executive Director of the Housing Authority of Travis County. And as part of our series on HATC in the community, let's talk about it. This month, we want to talk about food insecurity because November is recognized as Hunger Prevention Month. So I have with me our esteemed guest and subject matter expert, I consider. This is Beth Corbett. Beth is the Vice President of Government Affairs and Advocacy for the Central Texas Food Bank. Beth, thank you for being here today.
Thank you for having me.
Yeah. So this is a really important topic, I know, for me and for the people that I serve in our organization. And so it's really fun to have this conversation, but really important too, particularly for the listening audience. So food insecurity, could you maybe describe, in just generally speaking, what that means? And then maybe can you talk about what that really looks like here in Travis County?
Yeah, absolutely. I think it's a term that is heard a lot and not often necessarily understood. Some people describe food insecurity as a family, a household, an individual not necessarily knowing where their next meal is coming from. I also like to think about it through the lens of families, individuals who are having to make really difficult choices between food and medicine, food and paying their utility bills, food and housing and rent costs. And so again, it's a population of people that might be living paycheck to paycheck, and food, unfortunately, can be one of those household expenses that gets moved down the list of priorities. Here in Central Texas, over 500,000 people are facing food insecurity. Our food bank serves a 21-county region, and understandably, not surprisingly, the highest number of those food insecure individuals are here in Travis County, being the most populous county in that area. It affects everyone and anyone. We see and serve a lot of rural communities outside of the metro areas that face their own challenges. And then in urban areas, you have different challenges as well. But it's across populations, it's across races, it's across all types of people and families that you can imagine. And I think people are often surprised at how many of their neighbors are that close to making those choices.
Wow. I heard maybe the statistic, maybe 1 in 4, possibly?
1 in 4 children in our service area, and then 1 in 6 overall in the Central Texas region are facing food insecurity. Wow. Yeah. I think it's a variety of factors. It is not a surprise that the cost of living in this part of the world in particular has skyrocketed over the recent years and decades, really. We are still seeing sustained inflation following, coming out of the pandemic. So food prices are still very high and out of reach for a lot of families. There are limited transportation options in a lot of the areas that we serve. And then there are a lot of folks who don't necessarily have the mobility options, to get to a food distribution, as an example, or a grocery store.
Yeah. So they're subjected to trying to figure out what they can get access to, right? And that's things that are probably aren't the healthiest.
Yeah, they're, a term that some folks use. I don't know that it's in fashion anymore, but, you'll hear the term food desert. We at the food bank have started to use the term food swamp because particularly you'll find in both rural and urban communities, there may be food options, but the only option might be a gas station corner store. Which doesn't necessarily have the healthiest variety of choices for folks. And that's really a consistent challenge across the Central Texas region, as there are so many of those food swamps in many, many communities.
Right. Which leads to more health problems, right? Which leads to other things.
Absolutely. It's all interconnected.
Yeah. That's really interesting. So you mentioned COVID, so maybe you could talk a little bit about that. Like, what have you seen differently doing maybe post COVID in terms of access to food? What does that look like?
Yeah, COVID, I think, really shed a light on how many people are facing this problem. I think prior to that, even at the food bank, we didn't necessarily know where those pockets of hunger
Mhm.
existed. It was kind of a hidden population in a lot of ways. And I think the pandemic really shined a light on how many families are just that close, to not knowing where their next meal would come from. We, I think, have really pivoted in our approach in that we're using data to
Yeah.
drive decisions. So,
Sure.
where are we locating services? Where are we going to stand up programs? What new partners
Yeah, yeah.
are we going to reach out to and connect with, just to ensure that those folks that may have been under the radar prior to the pandemic are now front and center in our thinking as we're designing new programming and opportunities to support them.
Maybe can you give an example of something innovative that you've been experimenting with that will address the need better?
Yeah,
Yeah.
absolutely. A long list. I could
Okay,
I
well,
can go
that's
on and on and on. I think a great example actually is the partnership we formed with the Housing Authority in our Golden Harvest
yes.
market. Another, COVID also brought to light that the limits of a lot of the federal nutrition
Mhm.
programs like SNAP, like WIC, um, all of which are awesome, all of which are a very important safety net, but some of them, for certain populations, older adults in particular, are capped.
Mhm.
They're not an entitlement program. And so one of them that we run, CSFP, is a senior box program, but we have a limit in the number of
Yeah,
households we're
sure,
able
sure,
to
yeah.
serve. And so we were thinking, okay, we know these populations exist. We're using
Yeah,
this data. We
right,
have this new
yeah.
partnership. How can we get resources to these folks that aren't able to participate in that program? So we've launched the Golden Harvest Market
Yes, you
directly,
have.
really, as a result of our conversations with
Yeah,
you,
yeah,
and now able to provide that healthy, fresh produce
yeah.
on site for that population where they are. Bringing the food to where the
Yes.
people are, I think, was the biggest lesson from
Sure,
COVID.
sure. And those seniors really, really appreciate it. So I'm going to speak on their behalf and
Oh,
thank you all for being so generous and willing. So
oh,
thank you.
we
Yeah.
love to hear
Yeah,
it.
that's a wonderful program. Um so post COVID, you've seen obviously people are more mobile, but obviously there's still challenges related to just the inability to get what folks need. So, has there been more of an interest on the part of members of the community to help out, or has it like what have you seen um, you know, arising in terms of partnerships? I would maybe speak of
Yeah,
it.
I think, our food bank particularly is really evolving in how we approach partnerships. We have a designated um, group of about 250 community organizations that are our real backbone, boots on the ground partners. Those
Yeah.
are the traditional food pantries and soup kitchens that folks are familiar with. They are in all 21 counties we serve. There are over 100 of them actually here in Travis County. But again, we know even that huge list of organizations might not always be open at hours that are convenient
Sure.
for people, might not um, be on a transportation line
Yeah.
that folks can get to. And so we're looking at how we can, again, design internal programs in-house to start to deliver directly to those communities, to those places in the region where there are those gaps. There isn't that charitable option.
Sure, sure, sure. So transportation, you did mention transportation is an issue. Has there been any efforts made on the part of folks that are in that space as far as transportation to maybe step up and assist?
Yes, it's
Okay.
been really encouraging. Our data and research team, we actually have an in-house research team at the food bank, have been conducting food access community needs assessments, I should say, across all of our counties. We have concluded the one here in Travis County. The results are out there if
Mm-hmm.
anybody wants to read the report. But a theme that has come up again and again and again in every single county that we serve is transportation. It's at the top of the list. And we have recently formed a regional food system council that will bring stakeholders like transit authorities, regional mobility authorities, et cetera, to the table. We were really encouraged by those types of organizations participating in the community needs assessments. It was awesome that they were at the table listening to the challenges, thinking through how they can start to adjust their services to really include that food access piece as part of their planning. But again, it's all back to data-driven.
Yeah. No, that's good to hear. I mean, I'm glad to hear that folks is stepping up, you know what I mean, and really helping out because, I mean, we're all challenged by certain things. And, I mean, the community as a whole really has an opportunity to really sort of mitigate some of these issues. So I'm glad to hear that that's happening. So we talk about individual groups, but how would an individual personally assist in trying to address this need of food insecurity amongst, their neighbors or the region?
Yeah, absolutely. There are, again, opportunities to support either in your neighborhood where you might have one of our partners, to go volunteer at that place. You can volunteer at the food bank, obviously. We have tons of opportunities there or at one of our mobile distributions. This month, actually, because of the heightened need due to the government shutdown and the pause on SNAP benefits, we're actually staging over 50 of those distributions. So folks can always come out to one of those and, again, have that experience where you're serving folks in their community. You can always donate. Time, talent, treasure, all of the above are appreciated, I know, by both the food bank and our partners, who many of whom are volunteer run. They might not have a big operating budget. They might not have full-time staff. So the more hands on deck for them, the better.
For sure. Yeah. Well, that's excellent to know. I mean, I'm sure folks out there listening want to sort of understand maybe how they individually can help. So that's good to know. And so I know we talked about our partnership, and again, we're very excited about what has come about and want to continue on that path. So how could organizations like mine continue to do, be creative in doing more for those folks?
Yeah, I think it's really being willing to share information with us. It's sometimes the hardest part is just having the initial conversation, and it's the light bulb moment where you're like, oh, there's a gap and we have a solution for that. But it's making that effort and then, sharing information about where those needs are, what is the right solution for those needs. We know it's not a one size fits all approach to addressing food insecurity. An example of another new program we launched in the last couple of years is we call it the mobile pharmacy, FARMACY.
Nice.
And it's really part of our food as medicine initiative. We're bringing essentially a grocery store on wheels. It's really cute. We've actually been using it at the airport for the shutdown for some of those employees affected, but we deploy it to healthcare facilities. So when folks are going to have an appointment with their physician, they can essentially get a prescription, a food prescription, and come shop in the grocery store and take home healthy produce with them. Awesome. Things like that. But it's those conversations with housing, with transportation, with healthcare. It takes everyone, sharing information and reading from the same sheet of music.
Yeah, that's wonderful. Well, Beth, I tell you what, this has been very enlightening for me. I mean, knowing and understanding a little bit, but just knowing that there are so many things going on and there are so many people that are willing and are contributing. And I think that's really wonderful. So thank you again for being here today. I'm Patrick Howard. This is HATC in the community. We want to thank Beth Corbett for coming and speaking with us today. For those that are listening in the audience, please, this is our call for advocacy to really be a part of the solution and as we try to make our community better. So thanks again for listening and have a great day.